Hi, my name's Sophie Butterworth. I'm one of the doctors here at the Skin Surgery Clinic in Newcastle, and today I'm going to answer some of your questions about laser mole removal. So people will come to the clinic for a variety of reasons, but the most common reasons that I see are for raised or pigmented moles, and that can be anywhere on the body. We see lots of things called seborrheic keratoses or seborrheic warts. Again, these are very common skin lesions that can occur anywhere on the body. And also we see skin tags very commonly, and they're lesions that are often in skin creases, so around the neck area, armpits or groin. And all of these lesions are really easily removed with the CO2 laser. Some people will be having these for appearance concerns, and others might be having them because lesions catch or rub on clothing, or they might be in areas where, for instance, if they shave, if they're a gentleman who has a beard, when they're trying to shave, the lesions can get caught and bleed, or if they're lesions in the scalp, they can affect when you're having your hair trimmed. Some people also are worried that lesions can be non-benign, so potentially cancerous lesions, and they want them checked for those purposes as well. So after we've completed the laser treatment, we'll apply some ointment that's a bit like a Vaseline ointment, so a bit greasy, and we sometimes pop a dressing over the top. If the lesion's in a hair-bearing area, so like in a beard or on the scalp, we just leave the ointment only because the dressings don't stick very well in those areas. But anywhere on the body where it might rub on clothing, we would apply a sticky dressing over the top. For the day of the procedure, we normally ask that you avoid showering or bathing for that day, and then you can go back to your normal routine on the next day. So we would provide you with a little aftercare pack that'll have an information leaflet in it. You'll also have some of the ointment to take home with a cotton wool bud to apply it, or you can use a clean finger, and there might also be some dressings in there if they're needed. So we'll ask you each day, twice a day, if you can wipe off any old ointment with the antiseptic wipes and reapply new ointment. And you can do that whilst the lesion is forming into a scab. And then after the first week or two, the scab will likely fall off and you'll be left with a pale pink colour at the base of the lesion, and that will just take a little while to settle down. Some people ask if there'll be a scar in the area, and we can't always predict if there will be a scar, but we're hoping that very few people do form a scar following a laser treatment, and it's much less likely that you'll form a scar than with a surgical procedure. So if there's any worrying features from the clinical history or examination that we perform, then we cannot go ahead with the laser treatment. We will recommend some other options, so it would be possible for us to complete a biopsy of the lesion and send that for histology, so we can tell what the lesion definitely is, or we could surgically remove the lesion completely and send it for histology. The other option is you could go back to your NHS provider and they will be able to complete those same treatments as well. So when you come in, you'll come into reception and you'll be given some paperwork to complete. That will be giving us some information about your past medical history, any regular medications you take, or any drug allergies. And then you'll come through to the consultation room with one of the doctors, and there we'll ask in a bit more detail about the lesions you're worried about, how long they've been there for, if there's anything kind of worrying like any bleeding from the area, and we'll do an examination and check each lesion with a magnifying glass that we call a dermatoscope. If we're happy that the lesion is suitable for laser, then we'll go through to the treatment room, and in the treatment room you'll be asked to lie on a couch or to sit on the couch. The first bit that we need to do is just pop the local anaesthetic in, and that numbs the skin around the lesion so that all of the rest of the procedure is pain-free. We'll then remove the lesion with the laser, and we've got a little hoover at the side that takes any vapour away. And then once the treatment is completed, we'll apply some ointment to the area and sometimes a little sticky dressing over the top, and we'll give you some aftercare advice at that point.